Good morning, everyone. Welcome to Pediatric Grand Rounds. Thank you for joining us. We are in the Mill Mountain Conference Room. If you're anywhere near Inglewood, please join us in person. If not, thank you for joining online. Today's speaker is Dr. Leah Birdwell, one of our soon-to-be graduating PGY3s. She's a graduate of the University of Maryland in 2016 with a Bachelor of Science in Neurobiology and Physiology, and graduated from VCOM in Blacksburg in 2021. She met her husband in med school and loved this area so much that she decided to stay for residency. And they love it so much that apparently she's going to be staying here for a very, very long time for her first attending job. She will be starting at Carilion's New River Valley as a community hospitalist and a nursery physician in October. She has a passion for rural health and advocacy and has fallen in love with the Southwest Virginia area. She would like to pursue further interest in public health and medical education. When she's not working, which is a lot of the time, she loves to be outside in the garden, hiking, baking, and spending time with her boys, husband, cute little 1.5-year-old, and a male puppy. Yes. Please join me in welcoming Dr. Leah Birdwell.
Thank you so much, Dr. Parmeshwar. So we're going to get started because I have a lot to talk about today. So my topic today is media use in infants and toddlers, balancing a healthy development in a technology-dependent world. I have no conflicts or financial disclosures. So my objectives today are to review current guidelines and policies regarding screen time in infants and toddlers, to briefly explore the pathophysiology of our brains on digital media, and to discuss the effects of time and media on development, health, and social interactions based off the most recent literature, and to consider the realism of adherence and to think about the interplay of social determinants on media consumption. And then lastly, to formulate how we can apply current screen time guidelines to clinical practice. All right, so I want to start off by saying that I am a mom of a 1.5-year-old. We do have strict no screen rules in our house, but clearly sometimes that doesn't always happen. These do not have batteries in them, but he imitates us. So he sees us on phones, he wants to be on phones. So I understand this does not come from a place of judgment to other parents, but just talking about the most recent guidelines and recommendations from the AAP. So the most recent policy statement from the AAP is Media and Young Minds, and this came out in 2016 and was a revision from their statement that was actually put out in the 90s before that most recent revision. And then another technical report, Children and Adolescents in Digital Media, I did pull a little bit from, but this is an older demographic than what we're really talking about. So most of my information comes from the Media and Young Minds. So the current recommendations right now for pediatricians are to start talking about screen time early and to educate about brain development in the early years. So starting at those first well-child checks, even the 1 week when we see them, 2 months, because some parents are not, as we'll touch, are not aware of the guidelines. The Family Media Use Plan put out by the AAP, which we'll visit in a little while, and then the guidelines for younger than 18 months are to discourage all media use other than video chatting. From 18 to 24 months, the guideline is to advise high-quality programming and to use them with children. So put a big emphasis on that co-viewing, which you're going to hear me say over and over throughout the duration of this talk. And then using technology alone should be avoided. And then older than 2 years is to limit media to 1 hour or less per day of high-quality programming with recommended shared use between parent and child. So there's that co-viewing again. And there are guidelines for older ages, but for the purpose of this talk, we're just focusing on this age demographic. And then they recommend no screen time during meals and for 1 hour before sleep. And if you ask our sleep specialist, it's closer to that 2-hour mark. So additional recommendations for parents are to not to feel pressure to introduce technology early. Children are quick learners. These things are meant to be user-friendly. They will figure it out once they need to start using technology. And as I said, they're designed to be user-friendly. And then once again, there's that co-viewing. If viewing media, co-view. Avoid fast-paced programs and apps with a lot of distracting content and any violent content. To avoid using media as the only way to get the child to calm down. And then to monitor children's media content and test before using it. All right. So we're not going to watch the whole thing, I promise. Okay, we're not gonna watch the whole thing, I promise. But is anyone overstimulated from that? Because imagine that going on over and over and over. So what are some, I don't want to say bad, but what are some things that might concern you with this when you see it, as far as a kid watching it?
There's a lot of bouncing.
There's a lot of bouncing. There's a lot of movement. It's that overstimulating. There's noise. There's lots of color. It's like that 3D kind of image. So not to bash Coco Melon, that's not what I'm here for, but it is a very overstimulating, at least for me.
Put on their seatbelts.
I know. I don't even know. What about the safety? So just wanted to play that. And what really concerns me about this, more than, oops, sorry guys, more than just how overstimulating it is that when you go on YouTube, I was trying to show you the bottom, but it's not working, that there are just hours of streaming. So there are 2-hour versions of this, 3-hour versions, and they're advertised as that to hook and keep kids entertained for long periods of time. Oh no, I don't want to do that again. Okay, so our brain's on digital media. So constant fast-paced media, likes, sharing as we get older with the social media, this activates our reward system. And these interactions cause a strong but very short-lived dopamine release that ultimately leads to decreased impulse control. And the media makers that put out these things exploit this feedback loop, looking to maximize engagement and to hook their viewers. There's a large body of evidence revealing the structural changes that excessive media use can have on teen brains, but until recently there hasn't been a lot on this the age demographic we're talking about, from infancy to toddlerhood. But we do know the brain from 0 to 5 is rapidly growing and even more sensitive to outside stimuli and experiences. So we're going to talk a little bit about the critical period of brain development. So this is from birth to about 5 years old, and it's defined as when brain plasticity is at a maximum and sensory input is necessary to establish optimal cortical representations of the surrounding environment. So this is why that hands-on social interaction, playing with your child, or with caregivers playing with their children, is especially important in children under 2 years old, because that is how they learn. And then I want to talk about transfer deficit and technoference. You'll hear me talk about use these two terms a few more times during this talk, but transfer deficit refers to a robust finding throughout literature that we're going to talk about in a few minutes, that children who are under the age of 3 have difficulty learning things from video that are readily learned from face-to-face interaction and those live interactions. Technoference it's a new term, and it refers to the interruptions in everyday normal interactions, including face-to-face conversation, meal times, and just leisurely time together. So as you see, this family is experiencing technoference. They are, instead of talking to one another, they're all on their phones. A good thing I will say about this family, they are all using their screens together, which is recommended, that we'll get into by the AAP, for when you do start using screens, to do it in a shared environment. So what's the most recent literature say? So I am not trying to run a journal club here, but I am going to present a couple new studies, the oldest being from 2019 and the most recent one being published just in March of this year. So I want to just talk about these papers because I think they're really important and add to the guidelines and why these guidelines are so important for us as pediatricians to help try to implement. So this first paper I'm going to talk about is one that was published in JAMA Pediatrics in 2023, and it was screen time at age 1 year and communication and problem solving development delay at 2 and 4 years. So this was a longitudinal cohort study that was conducted in Japan with 7,907 children, so a pretty large study. And it looked at associations between screen time exposures at children of 1, and then domains of communication, gross motor, fine motor, problem solving, and personal and social skills at the ages of 2 and 4. If that sounds familiar, it's the ASQ. It's just the Japanese version of the ASQ. So findings that they found greater screen time for children aged 1 year was associated with developmental delays in a dose-response manner in communication and problem solving at the age of 2 and 4. There were no associations in gross motor delays found, but there were some associations with fine motor, but they were not statistically significant. This next study was one that was published in 2019 in JAMA Pediatrics as well, and it was the associations between screen-based media use and brain white matter integrity in preschool-age children. So this study was also a cross-sectional study of 47 healthy children aged 3 to 5 years. They studied them from the years of 2017 to 2018. And patients, the way it was designed, they completed cognitive testing, which was then followed by diffusion tensor imaging. And while the imaging was taking place, the parent completed what was called a screen Q survey, which is a 15-item measure of screen-based media use based off the current AAP guidelines. So at this, and they did the imaging, and what they found was that increased screen time was associated with lower microstructural integrity of the white matter tracts that support language and literacy skills. And this same group, they do a lot of work. It's based out of Cincinnati Children's Hospital in the Reading and Literacy Discovery Center. But this was a follow-up study that was done in 2022. And this was a different cohort of children, but it was similar where they used the screen Q scores and then did an MRI, but this time they were looking at the cortical thickness and sulcal depth of the brain. And then their findings were higher media use was associated with lower cortical thickness and lower sulcal depth in multiple areas of the brain. And these areas are linked to language development, reading skills, and social skills. And interestingly, this previous study, I forgot to mention, at the same time that they were doing that, they were doing on the same cohort, they were looking at the images and looking at the nurturing home reading environment and how that had an impact on the brain. And it was shown that when you have a nurturing reading environment, it may stimulate the same areas and support language and literacy skills, so the opposite findings. So this next one was also published in JAMA Pediatrics, and it was published in 2023. So this was associations between infant screen use, EEG markers, and cognitive outcomes. This one is a really cool study because it was over the longest duration of time. So this followed children. Moms actually were pulled into the study when they were pregnant, so in their first trimester, and they were followed into the ages of 9 years old. So this was a prospective maternal diet cohort with participants in the Growing Up Singapore Towards Healthy Outcomes population-based study, and it followed more than 400 children. And the way they organized this is, as I said, moms were enrolled during pregnancy, and at 12 months of age, screen time was assessed on weekdays and weekends, so they differentiated between the two. And then again, at 18 months, EEGs were obtained to look at the brain waves. And they found that the more screen exposure that the child had, the stronger the slower frequency theta waves compared to the high frequency beta waves that can indicate a less alert state and has been associated with inattention later on in life. And then they looked at the kids at 9 years old, and then the children underwent neuropsychological testing, and then at the same time, parents and teachers also filled out surveys on the children. And then their big findings were that with every hour increase in average screen time, the children had increased difficulties with attention and higher executive functioning. And I promise I'm almost finished with the studies. I just kept adding them on because I would find another good one and another good one. But this one is a French study, and its associations of screen use with cognitive development early childhood in a large French cohort, and this was published this year in 2024. So this was a very large national study in France and included 13,763 children. And they looked at children a little bit older, so not starting so early, but at the ages of 2, 3.5, and 5.5. And what they did, they assessed vocabulary, nonverbal reasoning, and general cognitive development, and they controlled for socioeconomic and lifestyle confounders with this. And This study didn't find as convincing evidence of detrimental cognitive outcomes as previous studies did. They didn't so much look at imaging either. But what they found was interesting is that the context of when screen time is, or when media is consumed, is very important. And if it's consumed during times, say dinner, when we sit down as a family and we have social interactions, it was actually more detrimental to the child's development. So they really found a lot of associations with the context of screen time. And this last study is screen time and parent-child talk when children are aged 12 to 36 months. And this was also published this year in 2024. And this was an Australian prospective cohort study that included 220 families. And it's a little bit different in the way that data was collected every 6 months, and language environment analysis technology provided automated counts of children's language environment and exposure to electronic noise. And their data were also adjusted for sex and familial and home factors. And their conclusions were increases in screen time were associated with decreases in the measures of parent-child talk, including adult words, child vocalizations, and back and forth interactions, with the largest decrease being at that 36-month marker. So, all that to say, more and more literature is suggesting that there are significant social and structural impacts regarding language and cognitive development with screen time in infancy and early childhood. And screen time not involving a caregiver leads to decreased interaction with caregivers, which probably really plays into that slow in development, because as we've touched on, that interaction with caregivers is very, very paramount for development. And then constant stimulation also allows the brain to never be bored. And I really like this quote by Dr. Michael Rich. He's known as the mediatrician. Before becoming a pediatrician, he actually worked in media and the film industry for a while. So he's kind of pioneering the whole screen time thing. And he just recently wrote a book, I forget what it's called, but it's about how to integrate screens and media in a healthy manner, because they're not going anywhere. We got to learn to live with them, but we also want to protect our children in their developmental outcomes. And he has a quote that boredom is the space in which creativity and imagination happen. And I really like that. So that time for free play, where we're not constantly entertaining, but our children need to use their brains to come up with ideas. I just really like that quote. So we all are aware of this, but I just wanted to touch on other impacts of excessive screen time. So it can lead to obesity, sleep disturbances, vision problems, which is one I feel like I forget about a lot, but that constant visual, the strain from looking at screens, and then down the road, behavioral and attention issues. So who's really following the rules? Because most of my patients, I will say, are not following that zero, no screen time rule. It's hard. And then in this Australian prospective cohort, they investigated screen time exposure on an average day. And as you can see, the violin chart, no one, or some people, but hardly no one is at that zero mark. So data was collected obviously at 6, 12, 18, and 24 months. And the average infant in Australia at 6 months, they were getting 1 hour and 16 minutes of screen time a day, which increased to 2 hours and 28 minutes at the age of 24 months. And then in a study done by Lammers et al., they looked at screen time and adherence, and only 62% of parents in that study were aware that there were any guidelines regarding screen time. So just awareness. And then only 46% of these parents could recite them correctly. So what influences screen time? So the biggest factor that influences screen time is parental screen use. So this is the #1 predicting factor of childhood screen use in the ages of 0 to 8. So with increased parental screen use, we'll get that technoference that I was mentioning, and interruptions with the development of joint attention and interactions. And then also, as you guys saw, my son, children watch what we do. They imitate us. They see us on screens. They want to be on screens. And then parental attitudes and perceived benefits. In that study that I just mentioned by Lammers et al., the #1 motivating factor found to be, or that motivated parents, was the perceived educational benefits for infants from screen time. This was then followed by enjoyment of the infant, caregivers' need to get tasks done, which I think is a big one, and then just general unawareness of the guidelines. Some studies have shown differentiating evidence on whether maternal education is a factor in screen time. However, in this particular study that I'm referencing, they did not find so much a discrepancy in maternal education level on the amount of screen time that the children got, but more so the mom or the parents' motivating factors. So moms with a higher education level, their motivation was that they thought they were getting an educational benefit. So there were just differences in the motivators. And we have to think about socioeconomic status. So once again, there is some inconsistent data and not a ton of data regarding this age demographic we're talking about. There are more for our older kids, but in one longitudinal cohort study I found in the UK, it was noted that children with parents of lower educational status and lower income did have higher rates of screen time. And that could be for a myriad of different factors. And then another study I found showed that higher rates of screen time in children predicted language and communication deficits in moderate to higher SES families, but not for children of lower SES families. And they postulated that this could be secondary to lower SES families having poor access to medical care compared to those families of higher SES status. And also this inverse relationship could be secondary to other variables in the household, which brings me to our next point is socioculture and family structure. So every household's different. We have single parents that have a lot of children. We have families that have, children ranging from newborns to 8 years old, and that 8-year-old can have some screen time. So how do you separate it from the different kids in the family? And then social norms of different cultures, and then daily activities that the family is involved in. And then lastly, I wanted to touch on screen time outside of the home. So things that are outside of the parents' control. They send their kids to daycare because they have to go to work. And this brought me, when I was touring for daycares for my 1.5-year-olds, one daycare I thought I really liked, I walked into their toddler room and there was just a TV playing on a loop of Dancing Veggies, which mind you is really nice for when you're trying to trim your toddler's fingernails, but just all day long, Dancing Veggies playing, it really turned me off to the daycare, and we actually ended up not attending because of that reason. And I was talking to one of my attendings recently, and in one of our well-known daycares in the area, they just put up a big flat screen TV. So this piqued my interest and I started to look to see, are there any state regulations for legislation in child care centers? Are there any rules? And if I'm wrong, I hope I am incorrect, but I could not find anything out there. There are no regulations in child daycare centers. The only thing I found in licensed day homes, so for in-home daycares, there is a rule of use of media such as, but not limited to, television, videos, video games, and computers shall be limited to not more than a total of 2 hours per day. And that's for all children across the board. So that's 0 infancy to older children. And that was revised in 2013. That was the most recent thing I could find. So this brings me to ask you guys the question, in what ways as pediatricians could we advocate on educating our communities and advocate on a larger community level for implementation of healthy media policies in schools and child care systems, especially for that early demographic where they're not using screens for work. It's just purely for entertainment. So all that doom and gloom and talk about how bad screen time is, how do we help as pediatricians? So first and foremost, I think we need to have some expectation management. Not all families are going to be able to eliminate screen time from their lives, and that's okay. We need to help them use screens in a healthy way. And screens and technology are ubiquitous in the world we live in. They're here to stay, and media can be positive if harnessed and used correctly. And then we need to remember that context and content, so that when they're watching, why are they watching, and what are they watching? Is it age appropriate? Does it have some educational benefit to it? Are very, very important factors. So what counts as screen time? Tablet use, phone use, TV use, even background TV use. When your child's not watching it, but it's playing in the back, that still counts as screen time because some of their attention is on that and they are not focusing fully on what they're doing. And then FaceTime and video chat are exempt from counting as screen time because even though you're on a screen, it allows you to interact with people that might not be close by, which is really important. So here I am. I was in Richmond on my 2-week adolescent rotation earlier this year, FaceTiming Julian, saw more of his belly than his face there, but FaceTime is good. My parents live 4 hours away. We FaceTime them a few times a week, and I think it's very important to make parents aware of that. And I also want to touch on the risks and benefits of screen time. I was talking with another attending earlier about how, you know, when you are a brand new parent, you're sleep deprived at the beginning, especially in that first 0 to 3 months, and you're trying to stay awake, but you're, oh, I don't want to have screens on, but screens are what's keeping you awake. You have to weigh the risk and benefits. Do you want to fall asleep and co-sleep with your child, or have some screens on the background to keep you awake? So this is not a hard all or nothing rule, but it's risk stratification and measuring those risks versus benefits. So we need to discuss screen time at well child visits, which I know is very difficult because we all know, and everyone in this room knows, that our time is tight in our well child visits. We don't have a lot of time to ask about the things that we already have built in. So we need to integrate this into our well child templates and try to add it in a way, and we'll touch on this in a minute, to where it's not a whole separate thing you talk about, but something we talk about when we talk about development, integrate it in. So we can simplify our routines by creating dot phrases on resources, and then handouts are important. So I have a lot of links at the end of this where I'm not sure if we have them at Carilion, but where we can add them on the handout page, but we should look into getting them because the AAP has some phenomenal handouts. And then lead with sometimes statements to acknowledge how hard life can be with an infant. Families are doing their best most of the time, and they're using media as a coping tool when they feel overwhelmed and stressed. So we need to say things coming from a non-judgmental way and more supportive. So using quotes like, sometimes when we're tired and exhausted, it can be easy to use digital media as a tool for a break or soothe your baby. Ask how often it happens. Use open-ended questions and shift the blame. So point to evidence showing that digital media companies are targeting young users' attention and seeking that engagement that we talked about. So shift the blame from parents, and then intersperse those motivational interviewing techniques throughout your interview with them. So asking those open-ended questions. How does it work for you? Does it help? What is the benefit of changing your routine? Do you like what you're doing? And then know your patient's social history. So we've touched on this a few times, and I think it's very important. Sometimes screen time is not the most important thing you're going to talk about in that visit. Sometimes there are way bigger social factors that need to be addressed. And often, if those social factors are addressed, the screen time might go down because the screen time is being used as a mechanism to cope for those social stressors. So just triaging where we need to put this and where in priority we need to put it. And then to leverage our existing tools. So as I mentioned, the AP has that family media plan, and they do have the Center of Excellence on Social Media and Youth Mental Health, which is a phenomenal place for resources. And then also harnessing the power of things like Reach Out and Read to promote books as an alternative to that media consumption. So we're going to talk about the 5 C's of media use, and that previous slide and everything going forward are things that I got off the AAP's website regarding media. So the 5 C's are the child, contact, calm, crowding out, and communication. So the child, who is your child and how do they react to media? Are they a child that could care less, they can go on and do, or are they a child, they see a phone and it is right up in their face and they get mad when you take it away? Content, what is worth their attention? Is it Daniel Tiger or is it Cocomelon? You know, think about it. What are they watching? And then calm, how do they calm their emotions? Are they self-regulated? Do they get upset? Do you have to use the screen to calm their emotions? Are you using it to go to sleep? How do they go to sleep? Do they have those self-soothing behaviors? And then crowding out, what does media get in the way of? And then lastly, communication. How can you talk about media in your home to raise a media savvy, responsible child? And these points act as starting points to facilitate discussions regarding media at well visit, and they're not intended to be recited at every well visit, but as I mentioned before, to integrate them in as appropriate, and then to help us give media guidance in a smarter and more memorable way. And then I would argue that there should be a sixth C, and that's that context that we were talking about. This is not one that is part of the, obviously, 5 C's because it's 6, but I just found it to be important, and it was mentioned very frequently in a lot of the studies that I found. So when and where, and then I should put why is your child consuming media? What is your motivating factor? So a little exercise I wanted to do together. So we are talking about these early age demographics. So from the ages of 0 to 18 months, we all know that this is a very important developmental time period with parents and caregivers understanding and expressing early language, learning to move our bodies so that we can explore the world around us. And then from an emotional and developmental perspective, infants need to learn to self-soothe, fall asleep on their own, play interactively with others, imitate us. And it's important for developmental milestones that they should not be crowded out by the media. So when looking at your child, what is a way you can incorporate this of how you can approach a parent when you're talking about a child at this age? And it's okay if no one says anything, because I can keep talking.
I started talking about this at like the 2-month visit.
Yeah.
And it's usually those visits I have a little bit more room. And I'll start off by saying, like, for your child's development, like, all development happens in the context of relationship. And so they need you to get on the ground, romp around with them, and roll and play and laugh. And they need, I'll tell families, they need your face. So it implies they need your attention, they need the 3-dimensional animation of your mouth and the muscles and whatnot to actually learn expressive language. To just start reinforcing that early. Because I do have 2- and 4-monthers who come in with phones to calm them down. So the other side of that is setting the stage for the visit, right? We actually don't need phones in our visits. We are the most tolerant of all childhood behavior, right? Like, we are the most patient people with children. And so, like, it is okay for your child to be scared or sad or screaming. And I don't want you to feel like you need to calm them down here in the well child check or in the doctor's office. And so I'll actually ask them, I was like, when we first get in, can you actually put your phone away? And that goes all the way through. If I have a teenager, I'll ask them to put the phone away and tell them they're the most important person in this room. And I need to know what they think.
Yeah, exactly. And then bringing, attention to children are different. Some children have way easier temperaments than others, and some are more easygoing. And just bringing attention to that, especially in that infancy time frame. Some babies hardly cry, and some cry constantly. And also acknowledging parents and letting them know and empathizing with them that you know that period's hard and that you're there with them to help support them. And then content. This is a pretty easy one for this age. We've talked about it. It's 0 screen time, other than that FaceTime and video chats. And if parents are going to implement a little bit of screen time at this age, which for whatever various reason that they so choose, if they need to, really honing in on the educational programming is not all created equal. There are a lot of things advertised as educational content with people with no credentials, influencers, YouTubers. So to focus on things that we know are good, like PBS Kids, Sesame Street, that are designed with understanding of child developmental milestones. And then calm. So Dr. Drake already kind of touched on this, using the screen to calm your child down. So ask how their child calms their emotions. Fussy babies are more likely to be given screens to cope and to calm down, and this can get in the way of helping them learn to self-soothe, further propagating the fussiness and the difficult temperament for the parents. And then some resources to help parents find healthy ways of coping are healthychildren.org, which is the parent side of the AAP recommendation. So I think that's really a great resource to let our parents know that that's out there. And then also a website called 0to3.org, and that also gives parenting advice for helping cope with difficult behaviors with children, and to also, once again, empathize and recognize that parenting is hard, and every caregiver out there at one point or another will question their ability to parent, and that these difficult times can be used as ways for them to build confidence and harness their power in parenting. And then crowding out. We've already touched on this, so when they're on screens, they're crowding out those other developmental milestones that they should be working towards. And then communication. So infants can't talk yet, but they're always watching and listening to us. And if media is on in the home, that's something that is grabbing their attention and diverting it elsewhere. And that the parent themselves or other caregivers, other humans in the house that are there in life have more of an impact on the child than something on a screen. Great. So a little bit different, thinking about our 2 to 4-year-old ranges. So when we're looking at the child, or just in general, for 2 to 4, toddlers are learning a ton of information. They are starting to form their personalities. They're becoming more talkative, independent, performing tasks, imitating us even more, mastering new things. And they can finally actually understand some educational content on media. And emotionally, we all know this is a huge time. This is like temper tantrum central. So it's very important for them to learn how to self-soothe and emotionally regulate through these tantrums. So looking at our child, once again, temperament, we're going to want to notice different personalities. As we mentioned, some children might be more outgoing and impulsive, while others are shy and slow to warm up to things. And some toddlers are obsessed with media and want it all the time. Others could care less. So just looking at that, how your child reacts might play into how much you're going to give them. If they're a child that won't let go of the phone when you give it to them for 10 minutes, maybe we should just find something else to do with that 10 minutes. And then content. So once again, the educational programming, PBS Kids, Sesame Street, Blue's Clues, Daniel Tiger, those were all ones that were listed on the AAP as having some educational benefit. And they're designed by people that understand childhood development. And the same thing for this age group, the YouTubers, the influencers that claim to have educational benefit, but there's no foundedness in it. And then the calm, the tantrums. Are you using, someone raise their hand?
I did. Did you find anything on Miss Rachel?
So
I feel like it has to be.
nothing particular, but I kept seeing the phrase, and the AAP, they would list things that they recommended by name, but nothing that they were not recommending by name. They used very broad, like influencers, YouTube influencer I saw over in my research. So she was the first one that came to mind when I was thinking about YouTube influencers, because she's pretty prevalent and popular. So I didn't see anything about her. I mean, in some of the mommy blogs and like not literature-based stuff I did, but I won't talk about that here, but yes.
Did they talk anything about the specific addictive nature of social media at this age? Like, they get it and it's, at this age, it influences the brain more and they crave more and more.
So I didn't find so much about that, but I think it's, that dopamine response, I think it's the same in little children as it is for older children. Those quick dopamine hits that we get, oh, this feels good, this is fun, this is great. And I was actually about to touch on this a little bit for context in this age group. I did find an article written about a kid who spent, and it was a 4-year-old, I believe, orders on thousands of dollars on, they had their mom's phone playing and they were on a gambling website, and then spent a ton of money playing that game, just clicking. So I'm not sure as far as the addictive, I didn't look too much into that, but I have to assume that it'd be very similar as in those dopamine hits, the decreased impulse control that I was talking about earlier. And as far as social media goes, children at this age aren't being too social. They're not on Facebook most of the time. It's more so that entertainment that they're getting, but that's a good question.
But I do think it brings up a good point, right? So when you're in that pathway, right, your brain responds to that, right? And so when you're hitting that dopamine pathway, that's the same that's used in social media, in drug use, right? And so it then downregulates, right, the amount of receptors and or upregulates, whatever. And so you end up getting an addictive cycle, which is important for parents too. When you ask them to stop using it, you're pulling their coping mechanism away, which what happens when you pull an addiction,
before it gets better.
Right, which can then create a tense home environment. So there's a lot of balance in this.
Yeah, and a lot of nuance for sure. But yeah, I assume it's the same dopamine pathway, and it's that fast-paced media, I think more so for children this age, that entertainment, that flash, that cocomelon, constant moving music, and stimulation. And so looking at calm, we talked about tantrums, and there's a lot of ways that parents can manage tantrums, and that's not so much the focus of this talk, but encouraging the parent to stay calm themselves is very important with tantrums, which is easier said than done. It can be really hard. And then to label emotions and to help calm them and work through the emotion with them. And then not using things like screens or media as a coping mechanism. And then crowding out, it's the same. So for this age, it can crowd out more of that playing, that moving, being active, being outside, and exploring nature and looking at books, chatting with family members, which are really important. And then once again, communication. At this age, we can use screens. Recommended, or the AAP does say that screens can be used in a positive way. So that's where this co-viewing really comes into play here. So you can watch a show with your child, but talk about it with them. Oh, look what Daniel Tiger's doing. What do you think he feels? Oh, look, what color is that? You know, bringing in different aspects of the viewing experience with them. And also teaching, you can teach good and bad behaviors from screens sometimes. So how to get the most out of screen time? As I'm sure you guys have noticed, I've hit on this a lot. There's a growing body of information that supports that there are little benefits and likely harm from media before the age of 18 months. And then co-viewing. Caregivers should do their best to be present with their child. And the parents should research content prior to giving it to their child because there's a lot of stuff out there. And then to schedule non-screen time into the day, and then also to set limits on screen time. And then boundaries are very, very important. So no screen time during meals. Do not leave TVs going on all day. Turn them on when you're not using them. And then use parental controls as necessary. And then also a big one, and this is a little bit for older kids, but I'm sure it does apply to this age group some, is no screens in the bedroom, because I've heard of people putting iPads in cribs with children. So media consumption should be in a shared, supervised place. So a central place, the living room, like that family that I showed you earlier. And then setting time limits, and then to discontinue 1 hour, preferably 2 hours before bed. And then to really, empower the parents to set good examples for their children, to remember that their screen use is the #1 predicting factor for their child's screen use. So I don't know if these slides are going to be shared with you guys. I think they are. Are they? I'm not sure. But okay, I hyperlinked a bunch of links here that are great resources for providers and parents, and some of those sheets that I was talking about by the AAP, you can see. So this is how to use the 5 C's for parents, and this takes you to the healthychildren.org. And then building healthy media habits for parents, good handouts we could use. And then, for instance, this is like the 5 C's handout for parents, and they're age stratified, and they talk about that, breaks it down just like I did. This is where I got all of that information from. So we could add that to our pamphlets that we hand out at the end. And then I just wanted to talk about the family media plan. And I think this becomes more and more important as children get older too. But I think it's important for parents and other caregivers to be all on the same page with media consumption during this age group. So you just go in, and then you can put in your family members, their ages. And it does take time, but once you do it, you can print it out, and it makes a review. Hold on, it's gonna make me do it. I'll do my family. So I'll do my husband, me, and my son. It's a hamburger. Then you put ages, and then you go through like priorities, yada yada, and then it makes like a rule guide sheet to follow. So how families will do things, and this is, you could put this on your refrigerator or something, just to have family rules in the house and guidelines to follow. So I think that's a cool tool to give parents. And then we're not going to go through all of these. You guys can take a look as you want. These are my references. And then thank you guys. This is us enjoying some of our non-screen activities. So working in the garden and camping at Hungry Mother State Park earlier this year. I think we have a little bit of time for questions and comments. And I just want to say thank you for Dr. Stewart, my advisor, and this is my last talk and presentation as a resident at Carilion. So I wanted to say thank you to all of my attendings, advisors, co-residents, and everything for teaching me throughout the past 3 years. Any questions, comments? Yes.
I have a question about the duration of the content. So, in my mind, anyway, I feel like when we're talking about the development of attention span and like maybe leading to problems with impulse control later or deficits in attention, the idea that like a child can sit through a movie takes more, like as they're getting older. So like, for example, we just started doing a once a week movie night with my 5-year-old. And in my mind, I'm like, well, that seems, you know, like obviously we're picking a movie that we think is appropriate, but it seems like it might be better than having this co-time where he's watching these short little clips for like an hour.
And I think that's using media in a positive way. So watching a movie, a family movie night, even though like the duration, and I think there's some nuance versus context, duration, but you're watching a movie as a family together, and I think that adds benefit to, it's something you're doing together.
But I guess like more
I see what you're asking
would
about
be
the
like,
duration.
yeah, like in the, I'd just be curious if there would be, and that would be hard to study, I'm sure, but just like
aren't as fast paced
Right.
usually, so
and
that's what you're
pay
looking
attention to follow the story.
Exactly.
Versus some of these things that kids get into, it'd be like a 5-minute little snippet of, you know, the characters from Cars. Right, yeah. Right.
Yeah, exactly.
So, yeah, and I just wonder if like that plays into being something to think about too, in terms of not just like what it is, but how long it is, and maybe sitting down together as a family to watch a 30-minute show or an hour show would be better than saying, hey, watch these like, you know, YouTube, just scroll, you know, whatever,
well, and I think,
for an hour.
right, there's a difference in those YouTube videos, like the purpose of the design is to catch attention quickly, right? Versus, like you said, a movie has a longer, there's power in the story, right? And so when you look at your design purpose, I think that's really what matters.
Yeah.
Those shorter things, in general, are designed to catch attention, and that is more detrimental.
And it kind of plays into that content and context part of it. Looking at the content, what are you doing? It's a movie's like a story, and then the context of it, it's a movie, it's a long story, you're sitting with your family, you're doing it as something to do together, and that's a positive experience that kids will remember. So I think it's very good, it's a good thing, and it's age appropriate, so yeah.
And it's even the difference between like letting them, like my 4-year-old watching Spidey and Friends versus the YouTube of watching kids open toys.
Exactly. Like the quality matters, the content really matters.
It's the same thing as adults watching people buy houses, like HGTV for children.
Fair. Stand down. But fair. That was a great talk, Leah. You talked about there being a lot of stuff to talk about in the Well Child Check. I would contend that this is probably one of our greater public health crises. You know, like the abdication of parenting that happens as a result of screen time. And so, you know, I think that this is one of those things to really get ahead of. And I think we're getting more data to support this over time. But yeah, it's a nuanced kind of multi-pronged, but we got to send the same message, you know, kind of across all fronts and really support parents in that, right? Like giving them permission, you know, it's hard, like you said, getting there with them is really hard to, you know, give them that space. And but I think that, you know, one, there's the addictive nature to it, but also like that kids need safety, right? And screens don't create safety, right? Like our mental health issues, developmental issues, inattentiveness, right? All this is secondary, or much of it, a little bit hyperbole to say all, but much of it is secondary to the insecurities that people have. And we can't fix all of them by remedying screen time, but if we can help people get back into relationship with their parents, and create as best we can in the right environments, safety with guardians, or with parents, then then I think that there's a lot of benefit to be gained there.
And serving as an ally
Yeah.
with the parents, we talk about all these rules we try to give them, but letting them know we're there with you.
Yeah.
We understand it's hard, so.
Did you find any difference in generational use, like in terms of like parents of a certain generation doing this versus this? Because I feel like there's also a component to where we have a lot of teenagers going into like young adults and older now that grew up with screens.
Right.
Mhm.
Like my brother is 19 and he was born in 2004.
Yeah, so screens were.
Yeah.
But they grew up with all of the like access to immediate movies, and like that was when you already had TVs in the car and all the things that didn't have to do the CD players. And so like I'm curious if as they become parents more and more frequently, if it's going to be more of a struggle.
Yeah, I wonder that too. I didn't see much on that. And also a lot of this has just many of these studies, there was not a lot until recently. There, were a few from like the mid-2000s, like 2010s, and a lot of this, it came out so quickly, media did. It was just like this rampant rollout, the iPhone, the iPad, and then we were like, whoa, 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 and then noticed how it really did harness kids' attention. So a lot of these studies are relatively new, but I'd be interested too to see the generational behaviors of parents. Like our parents had no idea, they didn't grow up with screens, so they were like, sure, whatever.
I would argue that point. TV's been around for.
Yes, okay. I should have, not iPads or iPhones.
I used to sneak up on my younger brother as he was watching TV. I could see he was watching the screen, getting into the whatever he was watching on TV, and I'd sneak up on him, I'd scare him. And I could do that reliably. So it's been there. We just have to recognize that the access to it has changed.
Yes.
The content has changed, and we as adults also do this. We have our own media that we watch. That's very similar. Look at all the popular media outlets. Very similar platforms is what we're showing to our children.
And that's true. TV, like you said, has always been around. And that's where the original screen time guidelines, I think back in the 90s, were just about TV. And then this whole boom of access to media being, handheld and everything changed the game.
I feel like if we're going to start talking, if we're going to try and incorporate it into our initial visits, like to me, the most important thing is to get a grasp of how does the parent use the screens. Because I think about myself, like as things have become more accessible, my own use changes. I find myself frustrated that I seem to be like pulling out my phone anytime I have like a free second where I'm not doing something. I'm like, oh, I must check and see what's going on.
Like without thinking, it's just,
But that's not how I grew up. And like, even now, I was just thinking, I was like, I might just get rid of my Apple Watch because I feel like now having had it for a while, it becomes like, but even my kids, like they want to like play with it at dinner time. They want to play with my watch at dinner time, and I have to take it off so that they won't play with it. And so things that I thought would be helpful in my life have actually become pretty distracting, and talking with parents about how they are using it when the kids are babies, and you're not necessarily worried about the kids using screens, but really getting a handle on, well, how do screens play into the family's life from the very get-go? Because now I'm starting to have to really think about what are we going to do in our house, like have like for dinner, we probably need to start like putting our phones physically in a different room.
a phone box or like a place.
Because otherwise they end up inevitably sometimes like creeping into the dinner table. They are sneaky.
I totally agree with that. Like parental, and that's what I was saying, parental screen use is the number one predicting factor of a child's screen use. So how often are you using it?
And I would add to that because, and Leah has seen me do this in the clinic as well. If I have a toddler sitting in the parent's lap and I want to do an oral exam for the child and they're watching something on the phone, I'll have the parent lift up the phone so the child will extend the neck, open the mouth, and let me look in the mouth without getting a tongue depressor. Okay, I get a good oral exam without a tongue depressor, that's good, but what else am I saying there?
Yeah,
Okay.
but it's acceptable
I can't,
to.
mom can't tell the child to open their mouth and have the child do it. We're not having the child learn how to do that. We're having them respond to the screen.
And I think we've all probably done similar things.
Times have changed. Like 20 years ago, there was this whole baby Einstein thing, and that was heavily promoted as everybody needs to buy these videos because they're going to make your children smarter. And that became a $1 billion industry. And many years later, then they said, those videos did nothing. But people genuinely thought that they were doing something good for their children by buying these videos, and then it became toys, and then it became, I think Disney bought them out for like $2.5 billion. But that's what was promoted at the time to be healthy for your child. So parents generally aren't trying, I think.
Exactly.
They're not, but
Parents
they're...
want to do what's best for their child, and that's why it's important for us to promote what we know based off current research is best for their child, because like you said, parents just want to do what's best, and that was that number one motivating factor, is they think that there's an educational benefit for their children from 0 to 18 months when actually research has shown that there isn't. So
Yeah, it's hard sometimes in instances like this where media and technology move so fast.
yes,
Where if we, and there may be some disagreement with this, and I would welcome that, but the research is going to be behind
it lags.
our lives and our clinics. And so I think you said something that was very telling, right? When Julian looks at a screen, nothing should captivate him like that, right? Like that just seems so abnormal. And so, before we wait for the data to come out, I think we need to look what we know about child development and be okay at sometimes like extending, acknowledge to parents, hey, there's not research, but what I see is this, right? That experience piece does matter. And especially with technology, I think being willing to just kind of get your ear to the ground and say, what doesn't smell right? And because if we just wait on data, we're going to, playing 20 years of catch up.
2024,
Yeah.
a ton of studies are coming out, but the iPad, the TV's been around for years and years. The iPad, just in the last 20 years, it's really, well, not even 15 years. Any other questions, comments in the room?
I always think the funny thing with like phones and social media, even saying FaceTime's okay, my kids do not understand the concept of a phone call. Because of FaceTime with grandparents, like anytime if I've called, I can hear Chuck going, no, it's just a phone call, mom's not there, because they're yelling to look at the phone. So it's quite fascinating what
What I find funny too is like, I don't even think of myself, I don't talk on my phone that much, but I'll see Julian, hello, and he holds it like this now, not like this, by the way, it's this, and hello.
Well, and like I got Zinnia has like a toy phone that she now calls her work phone and answers and goes, hi, it's Dr. B every time. That's what I do.
At least they acknowledge you're a doctor.
Yeah, sometimes. It depends, because it's still Dr. Drake. We're all about Dr. Drake. But she does do that. She puts that thing to her face like this, flat.
It really just does highlight though how much kids imitate us. What we do really, really matters, and what they do. And it's great. I was showing Dr. Parmeshwar a video of my son this morning vacuuming. So I'm like, those are the behaviors. Yeah, let's keep that one going. Fix his baby vacuum. Did you fix his vacuum? Yes, me too.
Have you noticed though, like in the last couple of decades, when you go into the room, how few parents have a diaper bag with them? They don't, a diaper bag. They don't come in like we used to carry. You had the food, you had diapers, you had books, you had toys to entertain your child when you went out. But nowadays you walk into rooms, there's nothing. It's the phone is there to cure everything. I'm like, how do you come out without a diaper?
It's the same if you go out to eat or whatnot, like, they used to have like, in some restaurants, the coloring mats, things like that, and it's.
Those stupid kiosks are driving me crazy.
What?
The kiosks where you can like automatically pay in some of those restaurants.
Yeah.
They have games and stuff, and Xavier's like, he keeps asking to go to a restaurant. I'm like, you just want to go to a restaurant to look at that thing.
Yeah.
And he says yes, like he's into it.
Well,
honest.
I just found on a recent trip, like reusable placemat that has markers that can wash off. And so we did get one of those and George loves it. So like we take the little thing of markers. It's like a fabric placemat. You can draw all over it, throw it in the wash, washes right out.
Yeah.
So.
That is
But, like,
so true,
most
though.
of the
I
time,
feel like
like,
I don't
kids
see
are just-
crayons at restaurants anymore.
But,
True.
Sometimes they have them, you have to just ask.
Yeah.
We just keep them in our diaper bag. I just
Yes.
take a coloring book and a pack of crayons now.
my kids have found a magnadoodle at the library, and they've been fascinated by that.
Nice.
Vintage.
Little toy. Yeah. Museum
My
slash
library,
library.
Thanks, Dr. Birdwell.
Yeah, thanks, you guys.